Imagine your child constantly complaining of stomach pain, nausea, and fatigue, but every medical test comes back normal. What if it's not a digestive problem at all, but a migraine hiding in the abdomen? Abdominal migraines are mysterious, often misdiagnosed, and incredibly frustrating for families. In this video, we uncover what they are, what causes them, and how to find relief. Stay with us to learn the signs, the science, and the solutions you've been searching for. An abdominal migraine is a form of migraine that presents primarily with abdominal discomfort rather than the more typical headache. This discomfort is usually described as a dull or achy pain centered around the midsection. Although abdominal migraine is relatively uncommon, it affects approximately 2% to 5% of children and about 1% of adults. The condition most commonly occurs in children between the ages of 2 and 10, and it may be associated with stress and anxiety as contributing factors. According to Dr. Reena M. Sunghavi, Director of Neurogastroenterology and Gastrointestinal Motility at Children's Health and Associate Professor of Pediatrics at UT Southwestern, the majority of children with abdominal migraines tend to outgrow the condition by adolescence. However, there is a notable association between abdominal migraines in childhood and the later development of typical migraine headaches in adulthood. Historically, abdominal migraine was not well differentiated from other conditions. In the early 19th century, it was commonly grouped under cyclic vomiting syndrome. The term abdominal migraine was first introduced in 1922 by Brahms, who described the condition in 3 adult patients. He characterized it by episodes of epigastric pain lasting several days, accompanied by nausea, vomiting, and occasionally diarrhea, despite normal physical examination findings. A personal or family history of migraine headaches was considered a necessary component of the diagnosis. In 1933, Wiley and Schlesinger further expanded the understanding of the condition by documenting cases of children with recurrent abdominal pain that correlated with migraine headaches. Today, abdominal migraine is recognized as a subtype of functional abdominal pain disorders. These disorders are diagnosed based on clinical criteria rather than through laboratory or imaging biomarkers. Other disorders within this category include functional dyspepsia, irritable bowel syndrome, and functional abdominal pain not otherwise specified. Abdominal migraine is currently defined as paroxysmal episodes of intense, acute abdominal pain localized to the periumbilical, midline, or diffuse regions. These episodes typically last for at least 1 hour and are severe enough to interfere with normal daily activities. Between episodes, the individual remains asymptomatic, which is a key diagnostic feature. In addition to abdominal pain, which is most often centered around the belly button, other associated symptoms may include nausea, dry heaving, vomiting, loss of appetite, pallor, photophobia, and in some cases, headache. While abdominal pain is a hallmark symptom, some children may also experience classic migraine headaches that occur independently of their abdominal symptoms. One of the challenges in diagnosing abdominal migraine lies in its overlap with other gastrointestinal and neurologic disorders. For example, in children who present with vomiting, it is essential to distinguish abdominal migraine from cyclic vomiting syndrome. The latter is characterized by repeated episodes of severe vomiting that occur with no apparent cause and resolve spontaneously, often without accompanying abdominal pain. Because many other pediatric conditions can mimic the symptoms of abdominal migraine, such as gastroenteritis, constipation, or even anxiety-related gastrointestinal discomfort, accurate diagnosis requires careful evaluation of symptom patterns, frequency, and family history of migraines. The episodic nature of the condition and complete resolution between attacks are important diagnostic clues. What causes abdominal migraines? The exact cause of abdominal migraines is not fully understood. However, it is believed that children with this condition may have a heightened sensitivity in their nervous system, particularly in the pathways that process pain and stress signals. Abdominal migraines appear to be triggered by a combination of internal and environmental factors. Common triggers include emotional stress or anxiety, sleep deprivation, travel-related motion sickness, physical exertion, exposure to flashing lights or prolonged screen time on electronic devices, skipping meals or becoming dehydrated, Certain foods and additives, including citrus fruits, excessive caffeine, aged cheeses, processed meats, such as ham and salami, chocolate, and foods containing preservatives or monosodium glutamate, MSG. Abdominal migraines are more commonly observed in girls and in children who have a family history of migraine headaches. In some cases, there may also be a link to underlying mood disorders, such as anxiety or depression. How are abdominal migraines diagnosed? Diagnosing abdominal migraine can be challenging because its symptoms often resemble those of other gastrointestinal disorders. In addition, younger children may have difficulty accurately describing their discomfort, which can further complicate the diagnostic process. Physicians typically begin by taking a comprehensive medical history and conducting a physical examination. They will ask detailed questions about the frequency, duration, and nature of the symptoms, as well as any potential stressors at home or school. A family history of migraines is often a helpful diagnostic clue. To rule out other causes of abdominal pain, diagnostic testing, such as abdominal ultrasound or other imaging studies, may be performed. Laboratory tests may also be ordered to exclude infections, inflammatory conditions, or metabolic disorders. The diagnosis of abdominal migraine is primarily clinical and is based on established criteria, including recurrent episodes of abdominal pain lasting at least 1 hour, associated symptoms, and symptom-free intervals between episodes. How are abdominal migraines treated? The initial approach to managing an abdominal migraine episode typically involves non-pharmacologic interventions. Encouraging the child to lie down in a quiet, dark room may help ease symptoms. Applying a cold compress or ice pack to the abdomen can also provide some relief. Pharmacologic treatment may be considered based on severity and frequency of symptoms. Physicians may recommend medications to manage pain, nausea, or vomiting during acute episodes. In cases where psychological factors such as stress, anxiety, or depression appear to be significant triggers, behavioral therapy or psychological counseling may be beneficial. Left untreated, abdominal migraines can lead to significant distress, functional impairment, and disruption of daily activities, including school attendance and social participation. Can abdominal migraines be prevented? While abdominal migraines cannot always be prevented, identifying and avoiding known triggers can significantly reduce the frequency and severity of episodes. Preventive strategies include maintaining a diary to track the timing, context, and possible triggers of each episode. This may include dietary intake, emotional stressors, activities, and medication use. Avoiding stimuli that have been identified as triggers, such as food with preservatives or MSG, excessive screen time, or environments with flashing lights. Ensuring regular hydration, and discouraging consumption of caffeine-containing products. Managing travel-related motion sickness by taking breaks during long trips. Teaching stress management techniques through activities like physical exercise, creative expression, or communication with trusted adults. Establishing and maintaining a consistent sleep schedule, with wake and sleep times varying by no more than 2 hours from day to day. In some cases, if episodes are frequent or disabling, a physician may prescribe prophylactic medications to reduce the likelihood of future episodes. What else should parents know? Abdominal migraines frequently improve or resolve entirely during adolescence. In many cases, children experience a complete cessation of symptoms by their late teenage years. However, it is not uncommon for individuals with a history of abdominal migraine in childhood to develop classic migraine headaches later in life. Ongoing communication with healthcare providers and careful monitoring of symptoms can help guide long-term management and support the child's overall well-being. The importance of recognizing pediatric abdominal migraine. Pediatric abdominal migraine is likely underdiagnosed, in part due to its overlap with other gastrointestinal and functional pain disorders. Many children present to community health centers where resources are used both to manage symptoms and to evaluate the underlying cause. Accurate diagnosis is essential, as studies show that approximately 72% of affected children report that their abdominal pain significantly interferes with normal daily activities. This condition can have a notable impact on a child's social and academic functioning, often leading to missed school days and reduced participation in peer interactions. Chronic abdominal pain, regardless of cause, can be distressing for children and families and is associated with a decreased quality of life. While many children experience resolution of abdominal pain symptoms as they enter adulthood, longitudinal data indicate that up to 70% of these individuals may go on to develop typical migraine headaches later in life. This highlights the importance of early recognition and intervention, not only to improve current quality of life, but also to potentially influence long-term neurological outcomes. Despite increasing awareness, significant gaps remain in the understanding and diagnosis of abdominal migraine in pediatric populations. Ongoing research and clinician education are critical to improve recognition, provide effective treatment, and support children and families navigating this challenging condition. So if you or your child are facing unexplained belly pain and nothing seems to help, it might be time to consider abdominal migraine. Early recognition can make a huge difference, and the right treatment can mean fewer attacks and better days. Like, subscribe, and share this video if you found it helpful. And check the links in the description for more trusted health info and support resources. See you in the next video.